थ्रोम्बोसिस की मॉर्फोलॉजी क्या है, अब हम ये डिस्कस करेंगे कि इसका स्ट्रक्चर एक्चुअली है कैसा और ये बनता कैसे है। ये सब कुछ हम पहले डिस्कस कर चुके हैं। अब हमने इसकी मेजरली जो चीज़ें डिस्कस करनी है वो इसकी बेसिक मॉर्फोलॉजी है, फेट ऑफ थ्रोम्बस है। लेट्स स्टार्ट आवर लेक्चर। द मेजर ऑब्जेक्टिव्स of this lecture are the morphology, the fate of thrombus, which includes the propagation, immobilization, dissolution, and organization and recanalization. These are the steps. किसके लिए कि किस तरह से ये थ्रोम्बस प्रोपगेट करता है, इमोबिलाइज करता है, डिसलॉज होता है, ऑर्गेनाइज होता है, रिकैनलाइज होता है। अभी हम इसको डिटेल में स्टडी करेंगे। Let's start with the morphology. Thrombi can develop anywhere in the cardiovascular system, in any artery, in any vein. Actually, the arterial or the cardiac thrombi typically arise at the site of endothelial injury या turbulence की साइट पर जो है ये ग्रो करते हैं। लेकिन जो venous thrombi हैं वो स्टेसिस की साइट पर ग्रो करते हैं। There is a difference between both. आर्टीरियल थ्रोम्बाई एंड वीनस थ्रोम्बाई हम बार बार पढ़ेंगे कि जी आर्टीरियल ऐसा है, वीनस ऐसा है। थ्रोम्बाई आर फोकली अटैच्ड टू द अंडरलाइंग वेस्क्यूलर सरफेस एंड टेंड्स टू प्रोपगेट टुवर्ड्स द हार्ट, सो दे आर टिपिकली अटैच्ड अंडरनीथ बट दे कैन बी डिसलॉज्ड as we have studied. Thus arterial thrombi grow in a retrograde direction from the point of attachment, whereas the venous thrombi extended in the direction of the blood flow. What does it mean? If there is a thrombus in an artery, तो उस थ्रोम्बस का प्रोपगेशन किस डायरेक्शन में जाएगा? आर्टरी के अंदर है तो वो उल्टी साइड पर प्रोपगेट करना शुरू कर देगी, जिसे हम कहते हैं रेट्रोग्रेड। और उसी डायरेक्शन में, जिस डायरेक्शन में ब्लड फ्लो है, वो तब ग्रो करेगा जब वो वेन के अंदर होगा या वो वीनस थ्रोम्बाई होगा। तो बेसिकली आर्टीरियल थ्रोम्बाई जो है वो ग्रो करेगा ऑपोजिट डायरेक्शन में, और वीनस थ्रोम्बाई ब्लड फ्लो की डायरेक्शन में ग्रो करेगा या प्रोपोगेट करेगा। ये इसका ग्रोथ पैटर्न है कि एक्चुअली ये ग्रो करते कैसे हैं। The propagating portion of the thrombus tends to be poorly attached and therefore prone to the fragmentation and the migration through the blood as an embolus, and it will cause the embolism. That could be air embolism if it is an air embolus. That could be fluid embolism if it is a fluid particle. That could be solid one. The thrombi can have grossly apparent laminations called the lines of Zahn. If you will see it with the microscope, then you will you'll grossly see the lines of Zahn. These represents the pale platelet and the fibrin layers alternating with the darker red cell rich layers. What does it mean? It means that the lighter portion contains the pale platelets and the fibrin one, but the darker portion contains the red blood cells. That's why it's dark. So you will see a representation of the lines, dark, light, and these are the lines of Zahn which we'll see in a thrombi during a microscopical examination. In this picture you will see the arterial thrombus and the venous thrombus. One is in the direction of the blood flow, one is in the opposite direction of the blood flow. That is the arterial one. And what you'll see the more macrophages in the arterial one but less or minimum macrophages in the venous. And there will be more red blood cells because it is in the direction of the red blood cells, and red blood cells are more trapped in the venous thrombosis than the arterial thrombosis. Then comes the arterial thrombi. Arterial thrombi are frequently occlusive. They are typically rich in the platelets, as I have told you before, as you have seen in the image. As the process underlying their development led to the platelets activation, and although usually superimposed on a ruptured atherosclerotic plaque, other vascular injuries, vasculitis, trauma can also be underlying cause. So arterial thrombi is having more platelet than the venous thrombi. Let's discuss venous thrombi. Venous thrombi are almost invariably occlusive. They frequently propagate some distance toward the heart. forming a long cast within the vessel lumen that is prone to give rise to an emboli. That means they are getting increased fast because these thrombi form in the sluggish venous circulation, and they tend to contain more red blood cells, leading to a red appearance due to the stasis. The veins of the lower extremities are most commonly affected. 90% of the venous thrombosis are. The venous thrombi also can occur in the upper extremities, periprostatic plexus or afferent or periuterine veins. What are post-mortem clots? These clots can be mistaken with the venous thrombi. The post-mortem clots are actually gelatinous, and because of the red cell settling, they have a darker red dependent portion and a yellow chicken fat appearance upper portion, and they also are usually not attached to the underlying vessel wall. So they are different from the venous thrombi. If you will see, and you will find the difference. Thrombi on the heart valves are called the vegetations, and the bacterial or the fungal bloodborne infections can cause valve damage, leading to the development of large thrombotic masses. So हमारा जो thrombosis है वो ultimately it will lead to an infective endocarditis if it is present in the heart valves. So what is the fate of a thrombus? If a patient survives an initial thrombotic event during the ensuing days to the weeks, then the thrombus evolves through some combinations. So it has become old. The propagation includes the thrombus enlarges through the accretion of the additional platelets in the fibrin, increasing the odds of the vascular occlusions and the immobilization. What it is getting propagate, it is getting increased. Actually, the platelets and fibrin are getting attached to it, and with the passage of time, it is getting larger. Then comes the immobilization. Part of all the thrombus is dislodged, transported elsewhere in the vasculature, and it will lead to death. If it will move to brain, it will cause the brain hemorrhage because it will rupture the artery, and it will block the artery first and will rupture the artery later. So immobilization could be dangerous if it blocks some major artery. Then comes the dissolution. If a thrombus is newly formed, activation of the fibrinolytic factors may lead to its rapid shrinkage and complete dissolution. With older thrombi, extensive fibrin polymerization renders the thrombus sustainability more resistant to the plasmin-induced proteolysis, and lysis is ineffectual. What it is actually, if the thrombus gets old, if it is newly formed, then it will be shrinked very rapidly and will be dissolute rapidly and completely. But if it is an older one, then it will be complicated, then its dissolution will be complicated. इसको रिमूव करना बहुत ही ज़्यादा कॉम्प्लिकेटेड हो जाएगा. अगर तो ये नया बनाओ और उसी चंद घंटों के अंदर इसको डील कर लिया जाए तो इसको डिसोल्यूट किया जा सकता है. लेकिन अगर तो इसको हमने बढ़ने दिया है और अब ये बढ़ चुका है, ये ऑल्डर हो चुका है, तो फिर इसको डिसोल्यूट करना एक बहुत ही मुश्किल काम होगा. What is the organization and recanalization? Actually, a thrombi becomes organized in the place where it is formed. It has endothelial cells, smooth muscle cells, and the fibroblast in it. And with the passage of time, capillary channels are formed in it to a limited extent. And it forms its pathway through it and re-establishing the continuity of the original lumen. So capillaries make their pathway from this thrombi, so that the passage of blood, so that the pathway of blood may not be disrupted. So it's a major question that what is the difference between arterial thrombi and venous thrombi. Arterial is the thrombi which is present in the arteries and heart. Venous is the one which is present in the veins. Which artery, that is aorta, coronary, cerebral, etc., and which vein, that is superficial varicose veins, deep legs veins, DVT which we will say. What it causes: arterial thrombi causes endothelial cell injury, atherosclerosis, vasculitis, trauma. What the venous thrombi cause? It causes the venous stasis, and it is usually mural, not occluding the lumen, but venous thrombi invariably occlusive. Its appearance is grey-white, friable with the lines of Zan, but the venous thrombi is red-blue with a fibrin stance with the line of Zan. By the way, I have forgotten कि मैं आप लोगों को बताना भूल गई, जो हमने पढ़े थे पोस्ट मॉर्टन, जो कि उसमें पढ़े थे हम कि वो जो निकलता है जिसमें चिकन फैट होता है, उसकी अपीयरेंस जो थी उससे डिफरेंट थी, और वो जो था नीचे लेयर से डिटैच था, वो अटैच नहीं था. उसके अंदर लाइन ऑफ जैन्स भी प्रेजेंट नहीं होती, उसकी मॉर्फोलॉजी में ये भी डिफरेंस आता है. अच्छा, दोबारा इसकी तरफ आते हैं कि रेड ब्लू विद फिब्रिन स्टैंड्स विद लाइन ऑफ जैन. इट्स अपीयरेंस इज रेड ब्लू, इट्स अपीयरेंस इज ग्रे व्हाइट फ्राइबल विद लाइंस ऑफ जैन. अच्छा, तो आर्टीरियल थ्रोम्बाई ग्रोज रेट्रोग्रेड एंड इट ग्रोज इन द डायरेक्शन ऑफ द ब्लड फ्लो. It forms a meshwork of the platelets. It's having the fibrin, red cells and leukocytes in it. And the venous thrombi contains RBCs with a few platelets because of the stasis. So it was formed with the turbulence. It was formed due to the stasis. So this is the difference between arterial and the venous thrombi. If you will see this image, you will see the composition of a fresh thrombus. It is through an optical microscope, and there you'll see erythrocytes present. Where the erythrocytes are present, that is a red, apparently red area, and the leukocytes with the purple area because of the stain, and the fibrin one, is recognized by its appearance. Leukocytes are the small purple dots, and red blood cells are the small little red dots. Its clinical features involve the thrombi are significant because they cause obstruction of the arteries and the veins and give rise to emboli, causes the embolism. The effect that is of the greatest clinical importance depends on the site of the thrombosis. Although venous thrombi can cause congestion and edema in the vascular beds distal to an obstruction, they are most worrisome because of their potential to immobilize the lungs and cause the death very rapidly. Lower extremities, DVTs, are also associated with the stasis in the coagulable state. So, with this, our lecture is finished. अब हमारा टॉपिक जो है वो ख़त्म हो चुका है. हमारे इस टॉपिक के अंदर किसी को कुछ ना समझ रही हो तो वो मुझसे रब्ता कर सकता है और पूछ भी सकता है. मज़ीद ये कि एक जूम क्लास मैं अरेंज करूँगी ताकि आपसे मेरी बात हो जाए और मुझे पता लग जाए कि आप किस तरह से पढ़ रहे हैं, क्या समझ आ रही है, क्या नहीं समझ आ रही है. लेकिन आप लोगों को ये सुनना ज़रूरी है. प्लीज़ इसको सुनें और समझें और फिर मुझे बताएं.